Good morning, everyone. Today we are going to see the anti-anginal drugs, which are also called as vasodilators. Before we begin with the discussion of anti-anginal drugs, let us know what is meant by angina or angina pectoris. So, angina is the squeezing or chest pain is known as angina. Okay, so what is the reason behind this angina is like we know that the arteries are the ones which supply blood to the heart. So any blockade, so if the uh, blockade within the blood vessels which supply to the heart, okay, so then in such conditions you can see this angina pectoris. So the blood vessels which innervate the heart, if they are constricted, is reduced supply of blood to the heart or part of the heart muscle is known as this angina pectoris. So the main reason is the diameter of the arteries that are supplied to the heart will get constricted and there is reduced flow of blood to the heart. Thereby, the pumping capacity of the heart reduces. And see, we have three types of angina, which is known as stable angina, then unstable angina, right? And then the other third category, there is the angina. Okay, so the first one is stable angina can be seen in the normal person also. It is why this happens is if we are vigorously doing any exercise like climbing a hill or uh, doing a strenuous exercise, so automatically the because more oxygen is needed to whole of the body, so some part of the uh, may not or the heart may not be able to pump sufficient blood to the muscles of the heart itself, and thereby this pain which is seen in the chest is called as stable angina. So this angina can be overcome by taking rest. So when you rest, then this angina will be lost and you will come to normal position. But in case of unstable angina, this is thing that bothers most, that is the this angina is seen when the person is under rest. Okay, so and this type of angina is called as ischemia also. That is ischemic heart means part of the heart will not get sufficient blood. That part leads to ischemic heart, or that region is called as ischemic heart. Then the other type of angina is also present. This also is seen at rest and it comes in episodes. Okay, and if these are not treated, they may be life threatening also. So these are the three types of angina pectoris, angina, and in all the things, the only our aim is to increase the diameter of the blood vessel and increase the supply of blood to the heart muscle, that is arteries. So the type of drugs which are used in case of the treatment of angina are the vasodilators. So these vasodilators can also be called as anti-anginal drugs. Okay, they're also called as anti-anginal drugs. Okay, okay, anginal drugs. Then next, the class of drugs which are used as anti-anginal drugs are, so one important class is the uh, organic nitrates. So this is the organic nitrates. So examples of the organic nitrates which are used as anti-anginal drugs are vasodilators. The first example is the nitroglycerine. The nitroglycerine. Then the second category or the second example for the uh, organic nitrates, example for organic nitrates is the isosorbide dinitrate. So this is the structure of isosorbide dinitrate. Then coming to the say what are these organic nitrates? A brief introduction of the organic nitrates. That is how are they? What is their chemical reactivity? What is their physical form? What is their chemical structure in general? So here organic nitrates are esters of simple organic alcohols or polyols with nitric acid. So they are the esters of the alcohols or polyols with nitric acid. Then such type of compounds are called as organic nitrates. So there is an exception here, except for the amyl nitrite, which is also used as the anti-anginal drug or dilator, which is an ester of nitrous acid. So this is a question that can be asked in your GPAT. Please kindly concentrate. See, the organic nitrates are esters of simple organic alcohols or polyols with nitric acid, are the isosorbide dinitrate and the nitroglycerin, whereas amyl nitrite, which is an ester of nitrous acid. It is not nitric acid, but it is nitrous acid. Then lipophilic, these organic nitrates are lipophilic esters. Lipophilic means highly uh, hydrophobic in nature. Then volatile, they are also volatile in nature. Volatile means at a lower temperature they can be converted into vapor state. Okay, and volatility is an important factor in drug formulation, because the potential loss of active principle from the dosage form can occur if your formulation is not done properly. Then moisture should be avoided during the storage of these organic nitrates to minimize the hydrolysis of the ester bond, which can lead to decrease in the therapeutic effectiveness. So in the presence of, as we know that in the presence of moisture, these esters can be hydrolyzed, which will lose their effectiveness or therapeutic efficacy will be lost. Then because of these nitrate esters, uh, the explosive nature of these nitrate esters, when they come in, that is uh, when they are in their concentrated form, they can cause, they are explosive in nature. So they have got the explosive properties. So we must have to dilute them in a variety of vehicles or and excipients, so that we have to prevent their hazard. That is, explosive nature can be reduced by suitably diluting the concentrated form of these organic nitrates with the suitable vehicles and as well as excipients. Then the lipophilic nature of these uh, esters makes these agents very effective in emergency treatment of anginal episodes as a result of their rapid absorption through biomembranes. So they have, as they are highly lipophilic in nature, they can easily cross the biomembranes, and quick onset of action is seen because of their lipophilic nature. So these organic nitrates are available as sublingual tablets also. As we know that in the lingual region, in the mouth or under the tongue. So the blood circulation, that is the blood vessels are present in many in greater quantity. So when the tablet is put under the tongue, it dissolves fastly and then directly it enters into the blood circulation, and that is because of its lipophilic character, it gets absorbed easily and quick onset of action is seen. Coming to the mechanism of organic nitrates. So these organic nitrates are the nitro vasodilators. They are also called as nitro vasodilators. So they act on the thiol groups which are present in the blood vessel, and they are converted into the NO form, and then which will lead to increase in guanylate cyclase enzyme. So what this enzyme does is it acts on the GTP, which helps in conversion of this GTP into cyclic GMP. So increased concentration of cyclic GMP will lead to the activation of GMP kinase, activation of GMP kinase. So the activity of this GMP kinase is it acts on the protein, that is the muscles involved in the uh, uh, contraction of these arteries or relaxation process. So it acts on the protein to give you the phosphorylated protein form. So these phosphorylated proteins act on the myosin to get converted into myosin phosphates. So these myosin phosphate later on converts into myosin light chains, and thereby the formation of myosin light chain will lead to relaxation of the arteries or the blood vessels. So when there is relaxation, then sufficient amount of blood can be pumped to the area, and then the uh, deficit of oxygen can be uh, overcome. Then coming to the same, there is the mechanism of action. So this was at the uh, cellular level. What happens at the cellular level in the blood vessels? Apart from that, when you say, when you look into the overall the status of the blood pressure or blood dynamics, so here vasodilating effect of organic nitrates on veins leads to pooling of blood in the veins and decreased venous return to the heart. So thereby there is reduced preload. So as if we can reduce the uh, workload on the heart, then also we can thereby the capacity to work will be lowered, and the oxygen required will be lowered, and even with this minimal amount of blood, the heart can perform the pumping action. Then the that's why we that is vasodilation of veins will lead to accumulation of the blood in the veins, and thereby less amount of blood is returning to the heart, and thereby there is reduction in the, that is the preload or decreased preload is seen. At the same time, vasodilation of the coronary arteries will lead to decrease in the resistance of the peripheral tissues. So decreased peripheral resistance will lead to decreased afterload. So the capacity to pump blood from the heart will be reduced because the peripheral resistance is lowered at the distal parts or the peripheral tissues. So this is how the workload on the heart is reduced. That is decreased preload and decreased afterload. Then decrease in both preload and afterload results in decreased myocardial workload and thereby reduced oxygen demand the myocardium. So our goal has been reached. So we want to reduce the oxygen demand by the myocardial tissues or the heart tissue. Thereby, the pumping action or the heart is restored. Then organic nitrates restore the balance between oxygen supply by venous dilation and oxygen demand by decreasing the myocardial workload. So this is also part of the mechanism of the anti-anginal drugs. So organic nitrates are pharmacological sources of nitric oxide. So the one which is responsible for the action on the blood vessels is the NO. Okay, that is the nitric oxide. NO is called as the nitric oxide. So these nitric dilators are drugs that mimic the actions of endogenous nitric oxide by releasing NO or forming NO within the tissue. So even though if you don't take the organic nitrates, there is some amount of the nitric oxide released in the blood vessels and cause vasodilation to some extent. But beyond certain limit, we have to take the external drugs, that is the anti-anginal drugs, which can in situ produce the nitric oxide. Free sulfhydryl groups play a key role in the venodilation by formation of nitrosothiol intermediate, which activates the guanyl cyclase, causing increased concentration of cGMP, which in turn block the calcium catalyzed vascular contraction. So depletion of sulfhydryl groups during this metabolic process leads to the development of nitrate tolerance. So depletion of this, that is attachment of these nitric oxide with the or reaction with the thiol groups will lead to depletion of the available thiol groups, and thereby the on further usage or quickly if you are going to uh, uh, take many a times these organic nitrates, they become tolerated because of the non-availability of the thiol groups, and thereby there is no vasodilation seen. Then increased cGMP also inhibits the platelet aggregation. These pharmacological actions of organic nitrates preferentially occur within portions of blood vessels containing damaged epithelium, thus making them extremely useful in the pharmacotherapy of acute ischemic events. Then coming to the synthesis of the two drugs which are there in the syllabus, that is synthesis of nitroglycerin. Then, so here in the synthesis of nitroglycerin, the starting material is glycerin. So glycerin on nitration, that is nitrating mixture, we call it as nitrating mixture, which is nothing but the mixture of concentrated H2SO4 and HNO3, which is called as nitrating mixture. So with this, what happens is there is removal of water molecules from the OH groups present in the glycerin, and they get nitrated. So the formed compound is called as nitroglycerin. And coming to the synthesis of isosorbide dinitrate. So here the starting material for this particular compound is the glucose is the starting material in this case. So glucose on reduction, that is addition of hydrogen in the presence of platinum catalyst. So it forms this orbital. So it is at this particular position where the hydrogen has been added. So the aldehyde group is converted into alcoholic group, and the formed structure, the remaining ones are the same. The formed structure is called as the ds orbital. Then this ds orbital in presence of the concentrated sulfuric acid will lead to the elimination of water molecule, and thus the ds orbital will undergo cyclization to form this particular compound, that is isosorbide. And this isosorbide on treatment with the nitrating mixture, again the same nitrating mixture, that is HNO3 and concentrated sulfuric acid, that is the nitrating mixture, will lead to the nitration of the OH groups, and the formed compound is isosorbide dinitrate. So these are the two examples, that is two synthesis of two compounds, that is nitroglycerin and isosorbide dinitrate. So we'll